at a Civil War field hospital. I'm going to tell you about my job in medical care in the South during the Civil War. People in the Civil War didn't know about diseases. We thought that diseases were spread through the air. Sometimes at the medical camps, we would build bonfires because we thought that the smoke would clear the air. That was actually more harmful for soldiers. We didn't know how diseases were actually spread, so we couldn't prevent them. As a result, many men died of diseases and infection during the Civil War. Sometimes the only way to save a man was an amputation because the bullets were big, made of lead, and very destructive to the soldiers. Wounds would be infected, and the only way for them to survive was to have an operation and amputate the limb or limbs. That is when they cut off the limb in order to save the rest of the body. Most of the time, the soldiers survived, but not for much longer, because of sanitation and lack of scientific knowledge. One expression you might have heard is bite the bullet. This expression means just tough it out. This expression came from when we had soldiers bite on a bullet before an amputation. After, doctors would apply tight bandages called tourniquets to stop bleeding after an amputation. During the Civil War, they did not have advanced medicines. Most medicines that the South had were from the North. So during the Civil War, they had a small supply. They ran out of painkillers and sometimes had to use whiskey. Some of the medicines they used, like mercury and lead, were poisonous. They would do more harm than good. Some of the tools that they would use were the bone saw, the scalpel, the splint, and the bullet remover. The bone saws were used to amputate the limbs. The bullet remover was used to remove the bulky lead bullets from a soldier's wounds. And they would use tree branches for splints.
At the start of the Civil War, only men were allowed to be nurses and surgeons. As the war raged on, there were not enough men to do these tasks. Wounded soldiers would wait for hours before treatment because there were so few doctors. They were forced to start allowing women to be surgeons and nurses. Most had very little training, if any, and were lacking the necessary skills. 3,000 women served as doctors and nurses. A very famous nurse for the Confederate side was Kate Cumming. She was an immigrant from the UK. Next, I'm going to talk about sanitation. During the Civil War, they knew nothing about being sanitary. Soldiers would throw their trash on the ground, surgeons would never clean their tools or their hands, and men would never change out of their uniforms. The surgeons' tools would get dirty and grimy, so when they put them in the wounds would get infected. Since they did not know how diseases were spread, they would easily spread in field hospitals. Thank you for letting us tell you a little bit about the medical care during the Civil War.